There are a number of things I wish were burned into the hearts and minds of providers during cardiac arrest. I think first and foremost is the understanding that we just don't know who will survive or not from resuscitation. So a humble attitude of this is important, this matters, and I'm going to do my best for the patient. One of the other things I'd say about post-arrest care is it hits us at one of the toughest spots in the healthcare system, which is collaboration across departments and across fields. Cardiac arrest is fairly unique that way, that it involves EMS, ED, ICU, neurology, critical care, cardiology. These are a lot of fields. They have different perspectives, different goals, different interests. And in any given hospital, sometimes getting them to collaborate well is not easy. I think the first step to addressing this is recognizing that it requires them. So some hospitals feel the post-arrest care protocol can just be an ICU protocol. If you're not engaging the ED in these conversations or the cardiologists or the neurologists, you're setting yourself up for trouble. So at the very start, one has to say this has got to be a collaboration, and I've got to identify a key champion in each discipline to work together. A fundamental challenge we have with post-cardiac arrest care is no hospital gets enough of these patients any given week, any given month. So for any provider, nurse, physician, you may only take care of one of these patients on a monthly basis or several months basis. So you're going to forget. You're going to forget some of the aspects. It's going to be new to you. Some things may change. So hospitals also need to recognize the need for champions to do point of care education, if you will, just-in-time education. Someone who could receive a phone call and say, hey, I haven't done this in a few months. What's the latest on this? Or let me run this patient by you to get your opinion. And these champions don't have to be physicians. They could be expert nurses. They could be APPs. Somebody who has just taken ownership of the protocol and taken ownership of the latest and greatest for what we should be doing for these patients.